Good afternoon. This is Beverly Morgan, the Director of Sales and Marketing here at Knollwood Life Plan Community. It's with great pleasure that I could bring to you my guest for today, and that is my sister, Artemisia Missy Moore. Um, she is our resident expert today, and I look forward to her sharing her knowledge and skills in regards to how to care for a loved one with Alzheimer's and dementia. I also wanted to share with you a few things about Knollwood in particular. Knollwood is a life plan community that has 4 levels of care. We have independent living, assisted living, we have skilled nursing facility and rehab services, and we also have Alzheimer's and memory care unit, which is why this subject is so near and dear to our hearts, is because this is something that we wholeheartedly embrace here at Knollwood. Knollwood is a 16-acre facility here in Washington, D.C., near the Rock Creek area, where we have the pleasure of serving older adults of the age of 62 and older. The etiology or the history of Knollwood is that we were once a military facility and we catered to military officers and their wives. In the last 5 years, we've now opened that up to the general public as well. So I just wanted you to know that Knollwood is a facility that's here for you, that can care for all of your long-term care needs. So we're going to move forward sharing with you about the topic of today, which is Alzheimer's and dementia. And why this is so important, because this is kind of the time of the year where families get together for the holidays in the fall. And you may see some changes in condition in your loved one from a cognitive standpoint that may give you some concerns. And you may want to start to look into other ways in which to care for and manage them. So hopefully today we're going to shed some light on some ideas in which to help you help your loved one that may be suffering from Alzheimer's and dementia.
All right.
So again, Artemisia, better known as Missy Moore, is a bachelor prepared nurse, registered nurse that have a plethora of knowledge and skills in regards to end of life care as well as Alzheimer's and dementia. Missy is actually an end of life care doula, and she is currently the 2024 National Black Nurses Association Brain Health Fellow. I want to introduce to you Artemisia Missy Moore.
Well, thank you, Beverly. Thank you for having me today. It's nothing like your sister, introducing you. She really makes you out to be a big deal. But I wanted you to pay attention that I'm wearing purple in regards to Alzheimer's awareness and dementia awareness.
Awesome.
So thank you so very, very much for having me. This is an unbelievable topic. And that's because we both specialize in caring for older adults. Some things may slip through the crack just in what we see every day.
Mhm.
So this is an opportunity for us to talk about what it might look like if someone is starting to have some signs and symptoms of not only Alzheimer's, but other dementias as well. If you could put the slides up for me. This presentation is supported by the CDC and the Department of Health and Human Services. The contents are from Us Against Alzheimer's, of which I was a 2024 fellow. I just wanted to let you know. Yes, ma'am. So our objectives, we're going to talk about the signs and symptoms of Alzheimer's. We're going to recognize risk factors, and we're going to talk about the disparities that we may see in people that may have some type of dementia. Next slide, please. Before I start talking about the aging brain, I just want us to think about how many people that we know that are caring for someone who may have dementia.
Mhm.
Things that, and you know what, how many we may not know.
Mhm.
We know, it's some people that we know that are caring for people with dementia, and it's some people that we may not know that are caring for someone with dementia. And I just want to say it's a big deal. It requires a lot of time and patience and resources and so on and so on. But we'll talk more about that. When we think about the aging brain, it changes as we get older. You know, hopefully we get wisdom and expertise as we increase with age, but processing the information is the difference. We may know a lot of different things, but we may not have the ability to process the information or manage a lot of skills. All of these things will slow down. And, you know, it's important that we start to pay attention to the small changes. Next slide, please.
When you say small changes, what sort of things would we be looking for?
Yeah, you know, it's some small changes that we may see in the people that we may live with every day. And not something as simple as I can't find my keys, but something as simple as they can't remember how to write a check.
Hmm. So you say like multi-step type of intellectual concepts.
Correct.
Okay.
And it has a lot to do with their executive thinking, planning things out.
Mhm.
Oh, what am I going to do today? I'm going to meet my friend for lunch, but they can't remember the time,
Mhm.
or they can't remember how to use the GPS or how to get to the restaurant, or it may be they can't remember the phone number.
Mhm.
A lot of different steps are being missed.
So question, there's different stages to Alzheimer's and dementia. So can you share with us about some of the different stages?
I will, as we move on in the presentation, I am going to talk about
Perfect.
the stages of it, just so that we have an understanding. So when we talk about dementia, dementia is kind of an umbrella word or diagnosis that they give, and it has to do with changes in the way that you think,
Mhm.
the way that you care for yourselves, and the way that you function. It has to do with your activities of daily living, big changes in that. So for the most part, we know that Alzheimer's is the largest population of all, the largest population of people with dementia have Alzheimer's disease. And of course, next it would be Lewy body, also vascular dementia, frontal temporal dementia. And just keep in mind that depending on the type of dementia will also determine the types of thinking problems that the person will have. Sometimes the person may be very, very calm and very sedate. And sometimes the person may be very anxious or very aggressive. And that has to do with the type of dementia that they have.
So as I just want to make sure I'm understanding. So it depends on what part of the brain is affected by the dementia. You may see different behaviors or symptoms that show up in that particular person.
Correct. Not only the area of the brain, but the disease that caused the dementia.
Oh, okay.
The disease that caused the dementia. So for instance,
Mhm.
it's some people that have dementia
Mhm.
from excessive use of alcohol,
Mhm.
right?
Mhm.
But their dementia is going to look different from someone who has vascular dementia,
Okay.
okay?
Mhm.
The next slide, please. So it's some other words that I want us to hear, because a lot of times when you go into a doctor's office, they say a lot of words, a lot of different things. And one of them, dementia, is also called a neurocognitive disorder.
Mhm.
So when you hear that, you know, people say, oh boy, I'm in bad shape. I got a neurocognitive disorder, when in fact, it's dementia. And it's not to say that dementia isn't scary. It's just that when you hear those types of things, it can upset you a little bit. But you know what? The neurocognitive disorder, when you hear that word, that should help you think about getting a specialist to help you get a diagnosis.
So what kind of specialist would that be?
It could be a neuropsychiatrist.
Mhm.
It could be a neuropsychologist, or it could be a physician that specializes in neurocognitive disorders.
Well, I just want to jump in just for a second because I wanted to share with the audience, one of the things that we do here at Knollwood in regards to our service to the dementia and Alzheimer's population. We do have physicians that come in that oversees the medical management of the residents that are here with Alzheimer's and dementia, and one of which is a neuropsychologist that comes in and offers some suggestions and oversight as to how should we manage the patient or the person. Offer best practices and make recommendations as to what it is that we're doing that we can do better to improve their overall quality of life. So I do feel like that is really, really important for us as the healthcare professionals managing individuals with Alzheimer's and dementia. And we also include the primary care physician. We also have a gerontologist that's a consultant that comes in as well. And we also have overall care plans that are specific and individualized to that particular person's type of dementia. Just like you said, there's different types of dementia. So we want to make sure that we're optimizing our plan of care for each individual that we serve here at Knollwood.
That's a great practice. And so in addition to just the care of it, is the care of the person, ensuring that, even up until they can't make decisions for themselves, that they have autonomy, that they're safe, that they're the least restricted in regards to medication or restraints. It has to do with dealing with the whole person, because the dementia is just a very small part of the person. Putting people, places, and things in place so that they still have freedom.
Right. And that we have a very engaging community here that involves our activity specialists. We also incorporate our rehab department too, whether it's our speech pathologist or our occupational therapists that will help with those components of their skill sets as well. And then one of the things that we do that is really comprehensive is we want to learn as much about the individual, how they were prior to the disease process, so that we can always bring them a sense of comfort and peace when some of their behaviors may surface. We just want to make sure we put them in a place of comfort.
That's great to consider as well. And one of the good things that really supports patients with dementia is staff that has great training, because what we realize is that when the person has some behaviors, it has to do with a trigger from whoever's caring for them. So they may ask you the same question 20 times, and each time you have to answer the question very calmly, because they're doing what their disease is telling them to do.
Exactly.
So all really great programs that you have in place. The next slide, please. So if you go back for me, that'd be great. There are as many as 50 different causes for dementia. I want us to hear that. I want us to hear that. And also, a lot of the causes for dementia are modifiable. So I have a question for the audience. I want you to pay attention. I want you to think about the last time your primary care physician has asked you or questioned you about your brain health. And if they haven't, then you should question them about your brain health, because now is the time to ask. What is it that, how do you think my brain is doing? Do you see any signs and symptoms of dementia? Because what the community is telling us, what the families are telling us, is that a lot of times someone may have a diagnosis of dementia, but it isn't mentioned to the patient because they don't want to upset them. So perhaps we can ask the physician ourselves, you know, how is my brain? Is it doing what it's supposed to do?
That's a good suggestion. I would have
Yeah.
never thought of that, to
Yeah.
be honest with you.
Yeah, ask them, is it doing what it's supposed to do?
Mhm.
You know, and if they, so I'll give you an example. You have someone that has a diagnosis of Parkinson's, right? We know that Parkinson's starts in the brain.
Mhm.
We also know that if you have Parkinson's, you're at a higher risk for dementia.
Correct.
So that's the time for us to ask the physician, so what else can I be doing
Right.
to slow down the progression of this dementia that I might get from this disease process?
Yeah.
And you know what, when we think about the modifiable things that we can modify to decrease our chances of getting any type of dementia, is really going to surprise you. I can't wait until you see the next
Oh,
slide.
I can't wait.
So the incidence, anywhere from 5 to 8% of adults over 65 have dementia. And guess what? Every 5 years, it'll double. Your risk will double for getting dementia. That's important to know.
It is.
That's important to know. So eating healthier is important. 50% of individuals in their 80s have some type of measurable dementia.
Mm. Wow.
That's what the CDC says.
Okay.
Now let's talk about the diagnosis. Let's talk about, this is important.
Mhm.
And this is the thing that I want us to pay close attention to, because diagnosis is telling us the disease that we have. And prognosis tells us how long we have.
Okay.
So when you hear your diagnosis, it doesn't mean that you're going to leave here immediately. That's important to know. Because when people hear diagnosis, especially of something that's incurable, they think, okay, this isn't working out well for me.
Mhm.
The diagnosis still gives us time to work on what the disease is. So in regards to dementia, there is no single test. And that's what the most challenging is. You know, if you're diabetic, they can do a blood sugar. You know, if you're hypertensive, they can take your blood pressure. But for dementia, is no single test. If they feel like you do have, excuse me, some type of dementia, what they will do is have you do a lot of tests, and the tests are frustrating.
Mhm.
They'll ask you the same question 5 different ways to see if you give the same answer. They'll have you drawing all kinds of things, and you'll say, you know, this is for children, but it's really checking to see how well your brain functions.
Well, you know, what I notice is that when interacting with someone that may have a mild state of dementia, if you engage them long enough, you may be able to find just hints of things that will give you an indication that there's a cognitive change or deficit in some sort of way. And so it's always, I understand why they would do that in some cases, so that they will know just like where are you in the process? More importantly, what can I do as a healthcare professional to help you manage these particular changes that we are identifying?
Yeah, so, and I'm gonna share something personal. My sister and I talk about it, you know, our great aunt, when she started to have signs and symptoms of dementia, my sister and I would individually go and talk to her. And when we would ask her very specific questions, she would laugh it off.
Mhm.
And because she was so charming,
Right.
no, right, Ben?
Oh, yeah, she
No-
was good at redirecting.
She was good at redirecting. And we finally went to our cousin and said, we want to talk to you about your mom. Your mom, we believe, has dementia. And I think that she's having some problems. And as it turned out, when our cousin went there, she hadn't been taking any of her medicines. It really went down a slippery slope. So asking those questions, getting those evaluations is really, really important. Because a lot of times people say, well, I'd rather not know, or it doesn't seem that bad.
Right.
But you're better off if you know ahead of time, because then you still have a chance to stop the fast progression of the disease. Brains, CTs and MRIs, these are done, and PET scans.
Mhm.
These tests are done because it shows the evidence of the changes in your brain. And you know what, a lot of times it may be done because of some type of disease process, like a stroke or a tumor or something like that. And that may also support your dementia. Laboratory exams, they're checking for other things. You know, so for instance, B1, they'll do a B1 because a person that has alcoholic dementia will be low in B1. Also HIV, because there is a component of dementia that is specific to patients that have HIV.
Yes.
So the lab studies are important as well. And then a psychiatrist. And part of the reason why they may do a psychiatrist first, because depression, anxiety, bipolar disorder, some of these symptoms mimic signs of depression. So we need to ensure that, you know what, the person isn't depressed.
Mhm.
We need to go through we need to check everything out before we give this definitive diagnosis. And it's not to say that the person may not have both, but it's up to a psychiatrist to help us determine it.
So one of the questions from our audience is, Kaiser pays for brain MRIs for, what do we think of online cognitive practices like this? I'm not so sure I understand what the question is.
Yeah, Kaiser probably will pay for a brain MRI.
Yes.
A brain MRI, but more than likely, it's going to have to be documented symptoms, probably over a period of time to in order for it to be approved.
Right.
It has to be something, and it also has to be something that's impacting your daily living. You know, in the past, you know, when insurance was great, you know, if the physician felt like it was something that he wanted to know, you could just pay for the test.
Right.
But now there's a criteria that has to be met in order for PET scans, CT scans, MRIs to be covered by the insurance.
So I'm not so sure if I really understand what the audience was asking, but what that's Missy indicated, when it comes to insurance providers, they will escalate certain tests based on what the findings are. They may start out something small like a CT scan, and then if they're not finding what they're looking for, to give you some evidence-based indication as to a diagnosis or a disease process, then they will continue with their search and trying to figure out what other diagnostic tools that they will upgrade to, like an MRI or a PET scan. I hope that is answering your question.
Okay.
Actually, she just came back, she says, no, it's not an MRI, it's an online app that has cognitive practices for the user. What do you think of that?
Oh, that's a good one.
They are
Brain HQ.
It's
Okay.
Brain HQ. I do know some people that use it, and basically what it does is, you know, the brain has a little bit of muscle in it too, and it's just strengthening your brain. It has you to do puzzles, thinking, memorization, And I feel as though if you have the ability to engage in it and it's something that you enjoy, then you should. I have a friend and him and his sister, he lives in this area, his sister lives in California, and every day, at the end of the day, they call each other and go over the New York Times crossword puzzle.
So what that does is it gives you like memory brain mapping. It's like an overlay that it kind of helps keep your brain like fresh, and the cognitive components of your brain, it just helps you keep those components of your brain alive and well. So those type of practices are absolutely supportive in dealing with people with Alzheimer's and dementia. I have another question.
Okay.
What signs should I look for in a loved one to start seeking medical help?
That's a really, really good question.
Mhm.
Some of the things that you will see, that they may look unkept, that they may not be bathing as much, that they're having frequent falls, that they can't remember where they put things, or they accuse people of moving things. Their vision won't be as good. Their hearing may not be as good. It's a lot of people that have dementia that have visual problems,
Mhm.
which is why they have the falls, which is why they have so many bruises, because they bump into things. It really changes. Also, hearing. Sometimes, depending on the dementia, they may have auditory hallucinations. So you would need to get their hearing checked. You go to check their medications. Either they're over medicating themselves because they can't remember that they took their medications, or they aren't taking the medications because they felt like they've taken them already. It may be weight loss because they've forgotten to eat, or the things that they usually eat, they can't cook them anymore because they can't cook well.
Right, but I can't remember.
They can't
They
remember.
can't remember.
Uh, 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 just trying to do simple things like run the washing machine,
Mhm.
flush the toilet, even unlocking the door.
Do you see, I know in the past for us, we've noticed that when visiting our family members, because we're nurses, we kind of see that we're the gatekeepers of our senior family members. So when it's holiday gatherings or whatever, you'll find that if there's someone in your family that had a pristine house, always kept things neat and tidy in specific places and things like that, all of a sudden the whole house is just disheveled. Or you'll see it even in their overall appearance, they're just not as well groomed as they used to be. These are just questions to ask, make you pause and ask questions, and just try to identify, like, what's the root cause? What's the etiology that we're finding some of these changes? What I will say is, don't overlook it. Don't underestimate what some of your loved ones are going through. Just make sure we're as supportive as possible. And yes, this is a good time to seek medical advice.
This is a good time to seek medical advice, especially around the holidays, because of loss. Remember that we're talking about older adults, and they have probably more loss than most of us know. And the holidays, no matter how many years it is, it can be difficult. So is it part of, the holidays? Is it part of loss? Or are we seeing something more, a different type of diagnosis?
Now, another question that I've noticed too is, if an individual has a mental illness, sometimes it's misdiagnosed by Alzheimer's because some of the symptoms do mimic each other. Have you noticed that?
You will find that, and part of that is seeking a specialist. And part of the reason why we want to seek a specialist is because we want people to get what they need to be well. We don't want people to be over medicated.
Correct. Correct.
By what it is that they think. So first we need to determine what it is that we have before us. Is it dementia? Is it a mental illness? Is it both? And if it is both, what is it that we can give the person that is the least restrictive so that they still have freedom?
I love that. I love, from being in a less restrictive environment and, being on a medication regimen that gives you the freedom to kind of be at your very best at all times, which is one of the reasons why, one of the guidelines for skilled nursing facilities in this country is to, on a routine basis, try to do a medication reduction, just to make sure that we're not over medicating our older adults. We want to make sure that we're optimizing their quality of life. So I like that we have those measures in place to indicate what would be the least restrictive, but optimizing their quality of life at the same time.
That's right. And just because it's something that we wouldn't do, it doesn't mean that it's something that isn't needed for the person with dementia. Just because they're pacing all day, as long as they don't fall, as long as they have the right to pace all day.
Right.
What we're responsible for is to keep them safe while they're pacing all day.
Yeah.
So we have to think about, what it is for them, what it is that their disease has them to do, and to keep them safe.
Well, being patient and kind is definitely one of the characteristics that you need.
I agree.
So as my granddaughter says, be kind. You gotta always be kind. So we do have to be kind and caring and compassionate when dealing with people with Alzheimer's and dementia. And that's one of the things that I love the most about the care that's provided here at Knollwood. We can move to the next slide.
So let's talk about some 10 early signs, okay? Memory loss that disrupts daily life. Now people say, what does that mean? I'll give you an example. You can't figure out, you're gonna get dressed, but you can't figure out what to put on, or you put your clothes on and remember that you haven't washed up, those types of things. Challenges in planning or solving problems.
That's a good one.
Solving problems. I just want us to think about how many people get scammed.
Yeah. Yeah.
Right now, if it was someone who was really thinking pretty clear, they'd be like, I don't know them, they just hang up the phone. But somebody, they'll be like, oh, you want me to go to my bank? You want me to, they play on those types of things. But it's other things, planning has to do with your executive functioning. So when you can't plan out what it is that you're going to do, it makes you feel disrupted. It ruffles your feathers.
Right.
Difficulty completing familiar tasks, writing a check out, filling up your gas tank, remembering how to get home. Confusion with time or place. I can remember I had a patient one time, and she said, I want to go out for a ride. I said, well, come on, get in my car, which I love. Put the windows down. And she said, boy, Alabama sure has changed. And we were in DC. So whatever she saw, she thought that she was in Alabama. That was where she was from.
And how did you handle that?
I said, yes, it has changed.
Just go with it. Don't try to refute it.
No, she was in Alabama. Why was I gonna argue with her? She just said it had changed,
Right.
It wasn't any reason for me to argue with her. Right. Trouble understanding visual images. Oh my goodness. So when people have dementia, it has something to do with their peripheral vision, and it kind of points in. So everything seems smaller, it seems higher, and they will have other visual problems too. which is why they have problems reading,
Right.
watching television, walking, stepping up or stepping down.
Right.
Why they have so many falls. Really, really important.
So it's funny because we recently introduced into our community this device. It's kind of like a robotic device called a gait better. And the gait better is exactly that. It helps people that have either cognitive changes or what have you, try to learn their boundaries and to see how they can react safely to the changes in levels of things. And that they actually really like that. It's something that is done in our therapy department. But it actually helps them correct some of the areas of concern to keep them safe and to help prevent them from falling as a result of it. So there's different things that
Well,
we
falls are a big issue
right,
for people with dementia.
correct.
So, I mean, whatever it takes to keep them steady and on their feet is a good thing. Next slide for me. Thank you. Next slide. New problems back one. New problems with words and speaking. So it's not that they don't hear you, although they may have some hearing problems. One surefire way, one way to assess whether or not somebody has dementia or not is getting their hearing checked. Because I just want you to think about how inappropriate somebody is when they answer your question when they can't hear.
Right.
Right? So if you get their hearing checked and you find out that they're having problems with hearing, well, they may not have dementia at all. It may have just been a hearing problem. But if they do, then they have difficulty with understanding language, words, not only what they hear, but what they mean. Or if they can read it, what it means. You may have to repeat it 3 or 4 times. Increasingly misplacing things and losing the ability to retrace your steps. They come right into the room and say, I'm looking for my glasses, and then sit down and then forget. Decrease or poor judgment. Not understanding safety issues. How they're not safe. They go in, put a tea kettle or put a pot on the stove and leave the stove on. Turn the water on. That's why they get rid of bathtubs a lot of times for people with dementia, because if they turn the tub on, they're gonna overflow the water. But at least if it's a shower, the water will keep going out.
Correct.
It's those types of things.
And the temperature.
And the temperature.
The temperature, they don't really have good judgment of that either.
And that's across the board, but more so with people with dementia. Withdrawal from work or social activities. And part of the withdrawal has to do with trying to keep up with all of the conversation. One of the worst things you can do is say to someone that you think has dementia or has dementia, you remember me, don't you? My name is Missy. And they may shake their head and grin, and they have no idea who you are.
Right.
So you just go up to them and say, hey, I'm Missy, and they'll say, I know who you are. Or they're going to act like they've never met you before.
Right.
You go up and introduce yourself, but when you ask them, do you remember who I am? Do you remember when this happened? It may make them agitated. And then changes in their mood and personality. I just want us to sit with that for a minute, because at some point people realize that they weren't what they were, and they can't remember what they used to, and they can't do what they used to. And that has to do with their freedom and their independence. So we need to allow grace for them.
Do they feel like they sometimes get frustrated when people try to make them remember things?
Oh, absolutely.
Yeah. Yeah, I've seen that a lot. And then even in social settings where there are multiple conversations go on, sometimes it's a little overwhelming to them. It's too much going on at the same time. So they're just trying to focus as best they can based on the circumstances.
Or everybody is talking around them.
Right,
and they aren't included.
yeah, that's not good.
Include them in the conversation,
Mhm.
even if they can't speak anymore, because
Mhm.
they can still hear you.
Right,
Oh, grandmother, I remember when you used to have a garden outside that had beautiful yellow daffodils. She may not be able to say a word, but she's included in the conversation.
right. Well, one of the things that I noticed too is that a lot of times, with people with Alzheimer's and dementia, their short-term memory is, there's a deficit. But their long-term care memory, sometimes you have some of the most enriching, engaging conversations when you
That's
just
true.
live with them where they are. And it's just so, that's one of the things that I love about, working with older adults. You can learn so much about them and their past experiences and all the things that they've done in their life that has made their life and their families so enriched.
I agree. At one facility where I worked, they would have the residents' pictures outside of their room to help them remember where their room was located. However, it wasn't a current picture. It was a picture of them when they were young,
Yeah.
because that is what they remember
Mhm.
themselves at a younger time. I can remember asking a resident one time, "How old are you?" She's like, "I'm 45." She was 83 years old.
Right.
I was like, "Well, you look good for 45." And, we just went on from there. Why am I gonna argue with her about her age? She said she was 45. She felt 45. It worked for her.
Thank you. Yeah, it's funny because another facility that I worked at, we used to always have pictures of certain loved ones. But some people, they always ask about their husband or their sister or their mother. So it's always good to have those pictures. And if they say, well, where's my mom? And you can get the picture and then have some enriching engagement or conversations about their mother and their relationships and so forth. So I like having that as a way to do things as well. I'm going to answer a couple of more questions. I think we're gonna getting off track. Let's get
Okay,
back.
all right.
Let's get back. When should I start to research community? Okay. At Knollwood. They want to know at Knollwood. So you can always come to Knollwood. You're welcome to come and tour our Alzheimer's and dementia unit. We have private rooms. We have communities that have outdoor patios. Our area is secured so that our residents here with Alzheimer's and dementia can walk and be engaged in the community. We have activities that are specialized specifically with people that have Alzheimer's and dementia, and the team works collaboratively in managing the whole person. That's one of the key factors about the service.
May I add something?
Sure.
If you have someone, you or your family member, that has been diagnosed with dementia, I realize that, it's something that you need to think about, but you need to start planning immediately. And it's not that you're going to need to do anything immediately, but it's important that you go and look at your options, to research your resources, because you want to be rich with resources. In the beginning, it may not take a lot of resources. Everything is fine, but when changes start to happen, you don't want to try to go look to make plans at the last minute. It's something that you looked at, it's something that you've researched, it's something that you reached out to people, places, organizations to try to get support so that when you need it, whether it's with your family or your faith organization or private caregivers or facilities, that you've looked at all the options. And then when it's time to make the decision, you already know what you want to do. It's tough to make a decision at the last minute.
It is. And that's the whole concept, a life planning community where you are taking the time to plan out the trajectory as to what your life is gonna look like. And I absolutely agree with you. There's levels to the involvement of community resources. Sometimes, as Missy indicated, sometimes it may be that you would just start out with adding a caregiver so that you can have a break while you go to the grocery store, or keep them safe while you go to the hairdresser or get a haircut, those type of things. That's really simple. You can do it, and then they're allowed to maintain their quality of life in their home. And their home is wherever they choose to live, whether it's in a community like Knollwood or whether it's in their home. And so residential home, I should say. And so that is perfectly okay. There also are available here in the District of Columbia. They have adult daycare programs that specifically are dedicated to people with Alzheimer's and dementia. So that's something else that you can take under advisement too. They have where they have shuttles that come and pick them up, take them to a enriched, engaged community throughout the day, and then they can go back and live with their families for the rest of the day.
Also, just mentioning resources. One is the dementia daycare that's at Iona Senior Services in DC. And the other is the Dementia Cafe, and that is at Sibley Memorial Hospital.
Yes.
So, of course, those are also two options for the district. Next slide, please. So when we're talking about the different stages of Alzheimer's, it's four stages, and the first is mild cognitive impairment, and that has to do, that's when you first start to see little changes in the person, and then mild Alzheimer's, where they're having more memory problems. Stage 2 and stage 3 of the Alzheimer's has to do with more physical things. Difficult being incontinent, not being able to go to the bathroom by themselves, not being able to ambulate safely, eating, but not the same way. So the texture of the food may be different. And then, of course, the last stage would be when the person may be completely bedridden or unable to walk, unable to swallow. Those are the stages. Next slide, please. I just want to talk a little bit about some of the statistics for Alzheimer's. 1 in 9 people age 65 or older have Alzheimer's. 2/3 of the Americans with Alzheimer's are women.
Why do you think that is?
Because we're smart.
That we are.
Yeah. Alzheimer's disease was the 6th leading cause of death in all adults. And the only reason why it was the 6th, well, it became the 7th because COVID-19 became the 6th in 2021. Next slide, please. It's the 7th leading cause of death in all Americans, but for African Americans, it's the 6th leading cause of death. And in Hispanic and Latinos, it's the 5th leading cause of death because of the other disparities that African American and Latinos have.
I have a question. Is Alzheimer's and dementia covered by hospice care?
Alzheimer's and dementia is covered by hospice care.
Oh.
It is, yes. Next slide, please. So by 2030, they're predicting, and this is on Healthy People 2030, that 40% of Americans living with Alzheimer's in the US will either be Latino or African American, just because of the additional health disparities that they have. Next slide. In regards to brain health, African American people are 2 times more likely to have Alzheimer's, and Latino people are 1.5 times more likely to have Alzheimer's. And they're less likely than white patients to receive a timely diagnosis. And part of that has to do with not talking about their brain health. They're more likely to report experiencing discrimination along their patient and caregiver journey. And that some of that has to do with not having the dementia diagnosis discussed with them, being told about their diagnosis later on. And then less likely to be enrolled in a cutting edge brain research,
Like the one that they have at Johns Hopkins?
like the ones that they have at Johns Hopkins.
Now, we're not a Johns Hopkins affiliate, but Knollwood is less than 5 miles from Johns Hopkins at Sidney Memorial Hospital, and they have an awesome program there. And so it's good to know that this is a resource that's available so that you can engage and get involved in cutting edge medicine.
That is absolutely correct. Next slide. So, it says how do nurses and other healthcare professionals, but how can all of us, next slide, modify our risk factors? So 40% of dementia cases could be prevented by addressing lifestyle factors. And how often do we talk about lifestyle factors in regards to all of the diseases that we see? For our blood pressure, for diabetes, for stroke, for COPD, all of these different things that we could do. So we absolutely need to increase our education about these diseases, especially dementia.
Mhm.
What it is, what it isn't, and understand how it's treated. Also, physical activities. Moving is one of the best things that you could do in the world.
Yeah.
Now, I don't like to go to the gym, but I do like to dance. So I've committed to like dancing for 15 to 20 minutes a day. It gets my heart rate up. It makes me sweat. However it is that you choose to do it.
Mhm.
And then the other is social contact, engaging people, talking about politics, the news, movies. I love to talk about all of the stuff that's on cable TV, trying to remember the people's names, which is great.
One of the questions that's answered, what recent advances in treatment for Alzheimer's disease?
It is some recent treatments. It is a medication. The medication that came out for a short period of time, unfortunately, I cannot think of the name of it, but the FDA pulled it back for additional research and to see how to modify the cost of it, because the cost of it, I think, was close to $2,000 or $3,000 a month. Yes, but the more we know how to prevention is a lot better than treatment.
Correct.
Back to the slide for me. Thank you. So, oh, no, back one more. Thank you. So hearing loss, we talked about that. Making sure that they don't have hearing problems, hypertension. When we think about hypertension, we know it has to do with kidney disease. We know it has to do with stroke.
Yeah.
That is a vascular problem, and stroke, there, a lot of people that have a stroke have dementia. And that absolutely has to do with managing your hypertension. Obesity. Obesity is one of the largest chronic illnesses that just exacerbate every other disease that you have. So if you can decrease that, then you can decrease your risk of dementia. Also, smoking. Smoking is it closes up your vessels. And we know we need good blood flow, right? To keep everything in our brain working. Depression, remembering that if we treat our depression, it's a good chance that it can decrease our risk of dementia. Also, diabetes. Diabetes directly impacts our vascular system.
Absolutely.
And if it's bothering our vascular system, then we know that we aren't getting good blood flow to our brain. Excessive alcohol. There is a dementia that's associated with excessive drinking. So if we decrease our alcohol intake, we can increase the chances of dementia. Also, a head injury, Trying to, something as simple as wearing a helmet when you're riding a bike,
Yep, safety first.
safety first, and air pollution. We wouldn't necessarily think about that in regards to brain health, but it has to do with oxygenation, how much oxygen we're getting to our brain. Next slide, please. So how we can help each ourselves. A neurovascular risk management. You know what that means? Asking your physician about your brain health. Is it doing what it's supposed to do? Am I in line with somebody that's my age? It's very, very simple, because they'll be, when you ask a direct question, they give direct answers.
Mhm,
Also, sleep.
mhm.
You need your 7 to 8 hours of sleep. When you don't have good sleeping habits, it messes up your brain. You have to have that good sleep. Also, social activities. We talked about, crosswords puzzles, meeting with people, talking on the phone. Listen, if you get an Echo from Amazon, you can see and talk to everybody. Physical activity, moving, whatever that means, whatever is safe for you to do to move. Nutrition, eating well. Eating well. Listen, we all want some of our favorites, but it's important that we have good nutrition to feed our brain. And then cognitive stimulation. One of our partners got online and said, "Is this a good thing?" Yes, it's a great thing. It's a great thing to help us keep our brain trained for all of the things that we need to know. Next slide.
It's funny you say that, Miss, because one of the dietary choices we have here is called mindfulness.
Mhm.
And it's a healthy choice option that we can offer our residents here. And that's part of it. We want to make sure that their whole mind, body, and spirit is being helped and kept healthy. And we want to advance and encourage their wellness at all times. So having good dietary choices is absolutely important.
So we've talked about modifying our hypertension. You can go to the next slide. Physical activity. We do whatever is safe for us as long as we're moving. That could be walking, jogging, riding a bike, whatever it is that we choose. Next slide. For sleep, get our 7 or 8 hours of sleep. You have to figure out what that means to you, whether or not you need to turn the TV off, whether it needs to be dark, whether you need new pillows or 1,200 count sheets. Next slide. Nutrition. It's important that you get good nutrition, and you may need to do a brain healthy diet, and your physician and dietitian can help you with that. Next slide. Social activity. Doing phone calls or virtual phone calls with your family, so that because loneliness directly impacts brain health. Next slide. Cognitive stimulation, whether it's reading or arts and crafts, exposure to nature, prayer, social engagement, meditation, any of those, whatever that you choose is important. And hit some resources, Us Against Alzheimer's Brain Health Academy. You can go to the website. They have courses on there that tell you all kinds of information about dementia and Alzheimer's. Next slide. Also, the Brain Guide, that's an app that you can put on your cell phone that gives you information as well. Next slide. Brainguide.org, that's the app that you can look at to get resources about your brain health. Next slide. And here are some other resources that you can tap into to find out what you need for yourself, for your family member, and for your community. So regarding, if you need assistance, you really need to reach out to someone that can help you. That could be the nurse, the physician, a case manager, a social worker, an Alzheimer's navigator. And you can start with the local Alzheimer's organizations in your area. They'll be able to help you. Next slide. So that's it. That's it for me. I hope we answered your questions, that you got a lot of great information.
Well, thank you, Missy, for coming and sharing your knowledge with us about Alzheimer's and dementia. And I just want to offer the audience the opportunity to come to Knollwood and tour our community and see what our Alzheimer's and dementia unit has to offer. We do offer 24-hour care, nursing care, physician services. Like we indicated, we have specialists that come out, whether it is a geriatric, a neuropsychologist, a gerontologist. We just have so many resources to care for our patients with Alzheimer's and dementia. And in case you are a caregiver and you are undertaking the responsibility of a loved one that is suffering with Alzheimer's and dementia, we do offer respite care so that you can get a break and then restore yourself so you can continue to be an excellent caregiver for your loved one. Thank you again for sharing your afternoon with us today. And remember, Knollwood is an option for you today.